Voters sent D.C. a very clear message in November: less government and less spending. But you know what? It's fallen on deaf ears in at least two major government agencies. The Internal Revenue Service and the Office of Health and Human Services looking for millions more out of taxpayer money to fund expansion. The reason? Obamacare. Senator John Barrasso is a Republican from Wyoming who also happens to be one of just two physicians in the U.S. Senate. Senator, welcome. Great to see you.
Thanks for having me, Gerri.
All right, so let's start with this additional IRS spending. What does this do to improve my health care?
Nothing, but it certainly takes away from the health of your wallet and your savings account.
Right.
The IRS is asking for another 1,000 agents, and that's this year. You know, in your report the last couple of minutes, you talked about how this doesn't come fully into play until 2014, so every year they're going to ask for more and more agents. In the part of the budget that just came out Monday, the president has asked for money for 1,000 more agents, and basically they've called this the largest expansion of the IRS in 20 years. 250 times in the budget for the IRS, they mentioned the health care law. So basically, the IRS is now starting to audit America's health care, and this is just wrong. They're going to have another 100 auditors and $10 million to go after the tan tax, the tanning booth tax, to go after the not-for-profit hospitals that don't pay taxes. They want to audit them, and there's going to be another $10 million and another 100 employees there. It's one thing after another. The call centers, they want to say, well, we have to beef up our 1-800 number call centers. They want millions of dollars there. And then you talked about Health and Human Services, something called the Class Act, which has been called a Ponzi scheme because it collects all the money in 10 years and then it goes bankrupt. Even the President's own debt commission, Gerri, said that we should eliminate, that they should repeal this thing called the Class Act, but there's money for that.
Let me stop you at Health and Human Services. What they want to do is essentially quadruple their budget to administer Obamacare. I'm just going to play devil's advocate with you here. If you have a complicated health care law, you've got to have a lot of government workers who are overseeing this thing. I mean, there's no two ways about it, right?
Well, you're right, but what we need for patients, and I practiced medicine for a long time, patients want the care that they need from the doctor they want at a price they can afford.
Right.
And nobody's getting that under this health care law.
Well, we were promised that we'd be able to keep the health care we have if we like it. Is that likely?
No. Even the White House, after the 131 pages of regulations came out, said, no, we're sorry that half of the people that get their insurance through work are not going to be able to keep what they have if they like it. And for small businesses, it's about 80% of the people who have insurance through small businesses aren't going to be able to keep it. They also said that the cost of your insurance premiums were going to go down by $2,500 a family. Never saw that happen, Gerri.
And it's probably going to hurt the deficit, too. I want to talk about doctors.
Well, I think it's going to bankrupt the country.
Well, that remains to be seen. We've talked about it as yet another entitlement program. Certainly the costs are going to be high. I want to get you, though, to individual practitioners, physicians out there who run their office as a business and rely on that business to support their families and others. Here's what doctors say about Obamacare. Will it improve quality? No. Only 18% said it would improve quality. It will deteriorate quality for 65%. How will Obamacare change the world for individual docs?
Well, it's going to make it harder for them to keep the doors open. More time on paperwork, less time with patients. So that's going to make it more difficult. There's going to be now a government bureaucrat between that doctor and that patient. You know, patients and doctors agree they don't want anybody between them in a relationship. Not an insurance company bureaucrat, not a government bureaucrat, no one. So it's going to make it more difficult for doctors to practice, and also because Medicaid reimburses so low, because of the $500 billion also in cuts from our seniors on Medicare, it's going to be harder for all of those folks to get in to see a doctor.
Right. Well, let me get you, though, to this idea of stopping it, defunding it. The president has said, no way that's going to happen. You proposed this state opt-out plan.
Yes.
How is that going? What's the situation with that? How far along is it?
Lots of people supporting this. It allows states to make a decision if the government, Washington, should be able to come in and mandate that everybody in the state must buy government-approved insurance. And I think states ought to be able to say, no, we don't want that in our state. About 7 states have already passed laws to that effect about trying to protect people in their own states. The whole Medicaid mandate, which is bankrupting states. states want to opt out of that. And you see, Gerri Brown in California and Andrew Cuomo in New York are talking about the impact it has on their states. These mandates coming out of Washington, it's going to cut back on their ability to pay for teachers, public safety people like firefighters, police officers. It is a terrible situation, and I think states ought to have a right to opt out of that Washington one-size-fits-all mandate.
Well, certainly Florida's already talking about opting out and may very well opt out for Medicaid. It's going to be interesting to see what they do. Clearly, a lot of people unhappy with Obamacare here and fighting it on the floor in this very building every day. John Barrasso, thanks so much for helping us out today. Really appreciate it.
Thank you, Gerri.